Welcome to Senior Living Visionaries, a podcast for senior living leaders who are looking to stay ahead of the curve in the industry. On this show, we feature leaders and innovators in senior living who are pushing the boundaries and creating new, effective services and solutions. And now, let's settle in as host Jennifer Drago connects us with today's guests.
Hi, and welcome to Senior Living Visionaries, where we showcase the leaders and innovators who are shaping the future of senior living. I'm your host, Jennifer Drago, strategy consultant and CEO of Peak to Profit. Today, my guest is Ann Conn. Ann serves as the president and chief executive officer for the McGregor Foundation, and she's got more than 25 years experience working in the senior living industry. She provides leadership to McGregor, whose mission is to serve seniors both through direct service provision and philanthropic support. McGregor provides rehabilitation, nursing, housing, and hospice services in conventional settings, as well as working to keep seniors as independent as possible in the community through its program for all-inclusive care for the elderly, or PACE, and we're going to talk about PACE today. Ann received her BS in Business Administration from Youngstown State University and her executive MBA from Case Western in Cleveland, Ohio. For the first 5 years of her career, she worked in public accounting, which I didn't know. That was pretty interesting. And then it looks like from there you went into senior living and haven't left. So we're so happy to have you. You also serve on the board of directors for Leading Age Ohio and on the Evergreen Cooperative Board. So thank you, Ann, for being here today, and welcome to Senior Living Visionaries.
Well, it's great to be here. Thank you so much for taking the time to learn a little bit more about McGregor and allowing us to share about the work that we do. I'm excited to talk with you today.
Yeah, well, you definitely are innovating in a number of ways and have some really exciting partnerships that we're going to talk about as well. So to start off, can you tell us a little bit about McGregor Foundation, its mission? We talked a little bit about its mission, but what are kind of the key strategic priorities that you and your board are focused on for the next couple of years?
Sure. So McGregor's been around since 1877, so we are a long time organization, not-for-profit organization in Cleveland, Ohio. And for many years, probably for the first 110 years, we were a standalone facility that was really focused on, I think the language that was used was home for aged women, which is always interesting to look back now on how the organization got its roots. But fast forward, 140 years now, really we are focused on expansion into community-based living and supports and services. And I know we'll get into that work in just a few minutes, but when you look at McGregor's strategic vision, over the last 20 years, we've been focused on supporting seniors and those who serve them, is kind of how we focus and make a decision on whether or not we move into a particular area. And as you know, and many of our colleagues across the industry know, that nursing home care, which was where we were originally established, has had some significant challenges over the last at least decade, let's say, and especially in Ohio with the COVID pandemic. And in 2010, we decided to move into community-based care with the PACE program, which, as you said before, stands for Program for All-Inclusive Care for the Elderly. And that transition really allowed us to become more of an insurance-based model. So we are, PACE is an insurance-based model where we take on risk and are really rewarded by supporting older adults in the community and helping them to age as independently in the community as possible for as long as possible. And that strategic vision for us has allowed us to weather some of these financial storms over the last several years. So in 2010, when we took over that program, they were supporting about 150 seniors. And today we support over 670 older adults in our program here in Cleveland, Ohio. So, and when COVID occurred, we really took a proactive approach with working with the state of Ohio to advocate for expansion of PACE across the state. We had a wonderful advocate in the Director of Aging who worked with us to better understand how PACE was able to pivot when so many adult day centers had to close and had to shift to community-based care. And PACE really allowed us to be able to do that in, frankly, in a matter of days. Mm-hmm. And that flexibility was pivotal to our ability to keep people safe in the community. And over the last 3 years, we've been successful in expanding, advocating for PACE expansion, which just in this the last year, the state of Ohio has awarded 7 other counties. So we had 1 county in Ohio that had PACE as an option, and hopefully within the next 2 years, we will have 7 more. So we're excited to get started with that. But we remain committed still to residential housing as well. So we do have, everything from independent apartments, assisted living, skilled nursing, as you mentioned before, and end-of-life care. But one of the things that makes us unique is our grant making. And we do fund about $1 million back into our local community a year to support older adults, mainly in affordable housing with services, supporting education for work, expansion of senior living workforce, and then quality of life, which is a small portion of our giving, but can be very impactful. So it gives you a little bit of picture into McGregor.
That's great. A follow-up question. I know we're going to talk about PACE expansion, and as you mentioned, I think you were awarded the ability to expand into an additional county. We'll get there in just a second. Do you believe that that the organization will be focused on brick and mortar expansion as well in the near term, or are you really going to focus on those community-based services?
We are really going to focus on community-based expansion through the PACE program. Where we are doing brick and mortar, it's in partnership with other affordable housing, affordable living developers. And whether that's in our local kind of backyard in Cuyahoga County or as we expand, we were awarded 2 counties, which we're excited to be able to bring to the organization. And in both of those areas, we'll be looking to help support further expansion of affordable senior living. So we have a developer that we've worked with over the past several years for one of those areas, and are hopeful to submit a submission to the low-income housing tax credit program here in Ohio in just a couple of weeks.
Nice. That sounds awesome. So you shared a little bit about how you got into the PACE business, and it sounds like that you see that as a big part of your strategic vision going forward. Can you talk a little bit about the impact? I know you mentioned that you really increased that program from serving 150 to 670. What kind of impact does that have in those individuals' lives? For people who aren't familiar with PACE programs, maybe you can I know you mentioned it's an insurance-based model, but maybe share how it impacts the seniors, and if you have any impact statements or research statistics you can share, we'd love to learn more.
Yeah, absolutely. So just to give a little bit of background about PACE for folks who have not had a chance to really dive into the model, it is an insurance-based model that's supported through a per member per month payment from Medicare and Medicaid. And to qualify for the program, you need to be at least 55 years or older. You have to live in the service area, which for us is Cuyahoga County, and you have to meet nursing home level of care. So all of these individuals, but for PACE, would be or could be living in a nursing home somewhere in Cuyahoga County. Now, as you can imagine, many, if not every individual, when asked if they could remain in their own home, would prefer to stay in their home as long as possible. So for us, on average, since 100% of our population is nursing home eligible, only about 7 to 9% of our participants live in a nursing home during their time that they're with us as part of the program. The average time that they're in the program is over 3.5 years. So for someone to be able to choose to stay in their home or be supported with family from a quality of life perspective, it's a amazing, I'm going to say, freeing choice for them, right? So they get to live where they would like to be. And for the family and really the caregiver, if you were to look at our satisfaction scores, over 97% of the people who've chosen PACE would choose us again and are satisfied with their care. So it's speaks to the service quality that we're able to deliver. And those individuals, when we look at overall, rehospitalization rates are lower. For the caregiver, if you've ever been a caregiver on your own, you know that the complexity of when you have to find, there's a medication change for your family members, that everything that goes along with that, whether it's getting the medications, whether it's updating the pill box, whether it's calling the doctor for that change, all of that is handled by the interdisciplinary team. So that's really the magic of the PACE model. When you look at how we are structured, for every 55 participants, there is what's called an interdisciplinary care team. So a social worker and a nurse are dedicated to the care coordination. They provide the, if they need skilled home care, they provide it. If they need coordination between the hospital, if they go in for a hospitalization stay, they are helping them to coordinate the skilled living back to home. And so those transitions of care are much smoother within the PACE program. And we also provide transportation to and from doctor's appointments and to dialysis and those types of things. So when you're a caregiver and trying to coordinate all of those services, it can be a significant burden. So for PACE, those are just a couple of things where we are able to be a partner in that service delivery with the family and allow someone to, or support someone in staying independent longer.
And for the 93% or so that are not in the SNF setting, the skilled nursing setting, that are living at home, do the majority of those come to a center on a daily basis, or what percentage of your 670 would you say are you are coming to you every day?
Sure. So we partner with other providers in the community. So we do have about 150 of those individuals live in assisted living or in group home settings. Okay. And those individuals don't typically come to the center because they're already in a group setting. But for the ones that are living in affordable apartments or in their homes or with family members, typically they come to the center anywhere from 2 to 3 days a week. And while they're there, they have access to their primary care, to therapies, physical, occupational, and speech therapy. They usually have some recreational therapy and the ability to visit with their, friends that they meet as they join the program. So we usually are seeing them a couple of times a week.
Yeah, that's awesome. That's awesome. So I know that, so you've been doing this since 2010, you said 14 years, and you're getting ready to expand, which is so amazing. I've learned about PACE programs many years ago and very impressed with them, but tell us a little bit about any obstacles that your organization has faced in this journey and how you've overcome them.
Sure. So when we first took over the organization, it had some regulatory issues that we had to address first. And we have a fabulous team, operations team, that has been leading the program for the last 14 years. They have the ability to really understand the regulations and make sure that we're meeting the basics, right? Meeting what we need to. So that's kind of the lowest bar, but what we expect. And then the ability to add on additional services. So probably our biggest challenge in the beginning was hiring individuals who were used to working in a fee-based model structure versus in a value-based. Now, fast forward 14 years, that's probably more individuals are working in value-based care than were when we took over in 2010. But that shift in understanding what the goals of care were for that individual, and what their baseline looks like, and what their, I'll give you a wonderful example of something where an individual who was hard of hearing and didn't want to keep the, hearing aids in. And yes, we could order hearing aids, but if they weren't going to wear them and didn't have it, it was disorienting for them to have them. In understanding the individual as what their goals of care were and how we could best support them to be independent. That's just one example, but there's many others. The second one is probably just the coordination and understanding, helping community-based providers that we partner with, helping them to understand how we can be good partners with them, and then how they can be good partners with us. So we choose other quality not-for-profit providers. We try to partner with for our short-term rehabilitation, our home care, the things where we have value alignment, so that we know we're delivering quality-based care, both in their homes as well as for short-term rehabilitation and assisted living, those types of services. So, choosing the right partners was a lesson that we learned very early on.
Right. Because this is essentially, it's a capitated model. So you mentioned value-based care, but there's one fee that you earn per member per month, and then you have to fit in all that care. And there's a lot of care that goes into a PACE program and within that per member per month. So that's where the great quality providers come in too as well, right?
It absolutely is.
Yeah.
And when you're thinking about how do you coordinate what's the most important piece of that care delivery, because just one person, it might be that they need to really have more attention to their medication management. Whereas another individual, it's critical for them to make sure they're coming to the center more frequently because they have dementia and their wander risk, and their family members don't want them to be at home, so they need to come in 5 days a week. So really, it's the interdisciplinary team that makes those decisions and helps to support the participant, which is how the individual is referred to because they are participating in their care, and they have an equal say in how the care plan is derived.
And you started this part of the conversation about challenges, talking about the regulatory environment. And I guess we probably don't want to understate that, because this is truly a Medicare program. So you're subject to Medicare conditions of participation, plus a Medicaid program. So you have those state regulations as well. And then does Department of Aging layer on top of that as well?
Yeah, the Department of Aging is really the body for the state that it does the administration.
Okay.
Probably one of the other challenges that I would point to is because we have been the only program in the state for the last several years, we are such a small portion of the Medicaid program for the state of Ohio, and we are a demonstration state. So there is a dual demonstration project that's happening. And so the state, our Medicaid, when they look at PACE, we're talking about 670 participants versus 70,000 that are with demonstration. So sometimes getting the attention or helping to understand the difference between our model and, let's say, a traditional dual program can be a challenge from a reimbursement perspective. So another reason why we're really excited about the expansion in Ohio is just to have a larger base from an advocacy perspective, as well as helping the regulators understand, and the folks who handle the reimbursement, what is included in PACE, because we're not exactly like in Ohio. Excuse me, in Ohio it's called the My Care plans. So My Care demonstration model.
I've been on a kind of similar topic. I do a lot of work in the continuing care at home space, which also, tends to have a wellness coordination model, not to the extent of a PACE program, but we'll call it a lighter prevention and coordination model. And I was doing some research around HEDIS and STAR measures and how you can, how these programs can actually impact on a positive note, those measures from a Medicare perspective, because when we're doing our work, we are assuring that people are getting the screenings that they need, that they're adhering to their medications, that their chronic conditions are under control, all the things that folks in the value-based world really focus on, right? To not just reduce care costs, but to do the best thing for the patients. Are you guys subject to HEDIS and STAR measures as well? Are you monitored?
Yeah, we're not currently, although there is still a significant amount of data that we submit to both our Medicare, as well as there's a group that does some benchmarking for us within the national PACE world. So while it's not here yet, it may be here in the future, especially as PACE expands rapidly across, many states are seeing this expansion that Ohio is experiencing right now. So I would expect that over time, that's something that could be added to our overall requirements. But I think the one other piece I would just point out specifically when you talk about value-based care, because we're both the provider and the insurance company, when we do an excellent job in taking care of our participants and maintaining their health, there isn't an insurance company separately that is making has to make additional money to have those funds then come to, a shareholder, to us, because we are a nonprofit model, at least at McGregor, that can then be reinvested back into our program or into other not-for-profit priorities. So we're really excited to be able to have that differentiator and demonstrate the magic of the PACE model, especially when it's supported through a not-for-profit provider.
You bet. On the PACE program side, would you say that McGregor is innovative in any ways where you might be leading the pack of other nonprofit PACE programs? Is there anything you want to highlight about McGregor's program?
So I think there are many programs across the country that are innovative. And while we do not have the scale of some of the programs that have been around in California, obviously was where the first program started. And there are some fairly large organizations that have been doing PACE for a long time and have been able to, I want to say, invest in innovation. We're probably more in the early stages, I will say, although we have made a strategic commitment to innovation over the last couple of years, and it's part of our strategic plan, and we have focused resources around it. So just a couple of examples where I think we are making a difference from an innovation perspective is really implementing our full technology, whether it's for electronic monitoring through another system called Intiscare. I'll utilize that, and that is a overlay over the electronic medical record that helps to risk stratify the population. So it helps our caregivers as they're trying to, our IDT teams, as they're trying to plan and help support the families, and where they will maybe add additional support where someone has had additional falls, or maybe they have been to the ER recently, so that we are trying to align the resources with the individuals that are requiring additional support. Because as you know, when you're an older adult, sometimes you need, you're doing really well and you're stable, and then you have peaks of where you have additional requirements. And we want to make sure that our resources are aligned in that way. So that's one particular area that we've implemented in this current year that went live, I think, in May. So that was one of our pieces. The other one that I'd just point to is a telehealth solution, which I know folks have been utilizing telehealth for some time. This one is actually in our nursing facility with the goal of treating individuals in place, so not sending them to the hospital. And that was, our goal is to treat 95% of the individuals who have a change, to try to keep 95% in-house. So we implemented that in September, and that has, we've seen a dramatic shift in the individuals that are on the phone that are comfortable. So I'll give you an example. Someone has a change of condition on a Saturday night, and historically we've been calling the physician on call, who's probably out having a lovely dinner with their family and not wanting to take that call. That has shifted now to this other system where the individuals, it goes telehealth, so they can virtually see, like you and I, they can see the patient, they can talk with the nurse that has the change of condition and get vitals and all of those things, and they can give orders at that time to keep them in the facility versus having to, no one wants to go to an ER if they don't need to.
Right.
It's traumatic for an older, it's traumatic for me. I would want to do it. But, especially for someone maybe who has other comorbidities that make it difficult to travel.
Yeah. Oh, that's amazing. Those are great additions to your program. And Thank you for sharing exactly what the impact of each is, because I agree with you. And for the population that you're monitoring, both the risk stratification and the telehealth options make a lot of sense. So that's really good. So I know for those senior living providers who aren't yet working in the PACE model, and in some states it's not allowed, like Arizona. So I'm going to be sure to send this podcast episode to our regulators who are actually considering, they're doing a little bit of research this year. So that's been a step in the positive, in the right direction. But for those who are considering PACE, what guidance would you give a provider on, what to look at, how to research, pros and cons? What would you say?
So I would, exactly what you were saying, I would encourage them to do research, because it's not allowed in every state currently. And when there is a movement to expand PACE within a state, there typically is an RFP process. So once they go through that process, and I'll give an example for Ohio, there was a very short timeline. So if you weren't paying attention to what was happening in your home state, you could have missed the proposal. The proposal came out in May and it was due by July, and they made the selection in December. So it's not an open process where you, similar to other types of providers, where you could decide that you want to open a home health and you can go through a Medicare process of becoming certified. So there is a significant amount of research. We have wonderful resources within PACE, the National PACE Association. Sean Bloom is always, and I'll share my contact information later on. I make those connections to him quite frequently when folks reach out to me, because there are significant resources that, he can give you an update on what's happening in your home state. We have shared kind of the work that we did in Ohio to move from being a single county to expansion, so that maybe hopefully other states that are looking to go through an expansion or add this option to their toolbox, is how we've explained it. PACE is not going to solve every issue. It's not going to, we're never going to have 70,000 people in the state of Ohio, because not everyone is the right fit for PACE. Mm-hmm. However, we want to make sure that the regulators from Arizona, for instance, if they want to talk to the folks in Ohio, that would be a great connection. I'm happy to make those connections. So that's one. The second one, I would probably encourage them to talk to or look at partnership opportunities, because if you have not operated a PACE before, it can be challenging just understanding where to start. And so in Ohio, for instance, while we are expanding into 2 counties, and frankly, they're both coming on board within 3 months of each other. So it's a fairly quick turnaround for us. The one is that we're expanding is just in addition to our current program. The other is in partnership with Ohio Living, because they already have the space. They are a known quality provider in that area. And so it made a lot of sense for us to look at other opportunities to work together with other not-for-profit providers. So if you do have this option in the state, there are a number of nonprofits that are actively expanding their PACE programs and would be open to partnering with other not-for-profits, especially if you're already serving the community and you have space available that you're looking to retrofit. So those would be 2 kind of basic things that I would say. And then the other thing I would just say, from an insurance-based model perspective, understanding where your risks are, because can be risky. But what I will say is, from a senior living provider, we're comfortable taking employee health risk. So why aren't we comfortable taking a risk when it comes to provider care that we get to help craft and support? So I think folks they don't give themselves credit for some of the expertise that they already have, that they're using to benefit their insurance partners in the community today, when they could be part of that solution.
That's a great piece of advice, right? For us is let's not, and senior living sometimes is known for being risk adverse, and this is not a risk adverse model. This is a all in, all encompassing model. So I love that you also shared that you're going into partnership with Ohio Living, and congratulations to Ohio Living for getting McGregor Foundation as a partner as well. I think that's a great model. Are you able to share maybe from a margin perspective the margin opportunity that comes from a PACE program? Because it can be pretty significant. Now that supposes that you're managing your expenses well and all those care and utilization things, but what can you tell us about
So
margin?
typically I would say between 5 to 7% is our margin. And that's after, I would say that's our EBITDA for
Mhm.
folks who are using that language. Um, it can depend on your state Medicaid. So what I will say, for when you look at McGregor as in our history, the PACE program and that model is the only way that we have found to still have a mission and a margin when you're serving a Medicaid population. So traditionally, especially in the nursing home environment, Medicaid is usually below cost, significantly below cost, and you do the skilled services to help supplement, to hope that breaks to work to get it to break even at the end of the day. But in PACE, it really allows you to make when you make decisions around supporting individuals in a less restrictive environment and help them to be as independent as possible for as long as possible. Those when you're successful in doing that, then obviously you can benefit from a margin perspective.
Mm-hmm. Yeah,
So,
that's really good point that this is a Medicaid product where you can actually have a margin, because you're exactly right. I come from the healthcare world before I got into senior living, and hard to make margin on most Medicaid programs.
absolutely.
Okay. Well, so we talked a little bit about partnership. We're going to shift a little bit from PACE to another innovative partnership opportunity that you're engaged in around workforce development, recruitment, retention, helping to build the skills of staff who want to work in the senior living industry. So before I try to muck it up by trying to describe it, why don't you describe it for us in what you're doing?
Yeah, absolutely. So over the last 2 years, we've been working with other not-for-profit providers in the Cleveland area. So this really, again, came out of some of the work that happened during COVID, where we banded together as a kind of a network to help solve some of the solutions or some of the challenges that we were having. And there's 4 partners. So McGregor is one of them, Judson Senior Living, Eliza Jennings, and then Jennings Center for Older Adults. All standalone organizations, some faith-based, some not, but all not-for-profit providers, where we were facing challenges with entry-level workforce. So specifically, we started targeting individuals, trying to recruit and retain individuals that maybe were not historically in healthcare and wanted to get into the space, but didn't have the ability or the luxury to take off, or let's say go to training in the evening and take off for a period of time to become certified. So we are recruiting and training in our state. They're called state tested nursing assistants, or certified nursing assistants in other states, where we're hiring the individual and we're paying them while they're going through training. So they're hired at a base rate, and they're paid that for usually it's 3 weeks of training time, where they're in a classroom setting and clinicals. Once they complete the class, then they get a $3 bump in pay. And then while they're waiting until they take their state licensure exam, and then once they pass that exam, then they are bumped another $2. So in a very, really less than 6 weeks, typically, if they're moving along pretty timely, they can have a significant increase in salary. So it's been extremely successful, and we've been able to recruit individuals that maybe weren't thinking about senior living, but were interested in becoming licensed. That particular model now has, I want to say, morphed some, and we have kind of leveraged that for a second pilot, where we are partnering with a software called Arena Analytics, which is a artificial intelligence model that tries to align the individual with the role. So there's not a good or bad person, or from that standpoint, it's just, are you a good fit for that particular position? And the long-term strategy for this pilot, let's say Cleveland is one of the markets that Arena is working on to create both so we have the senior living, the way it was described to me, as a hallway, so that all four of us that are working together, someone could apply at McGregor, let's say, and complete this. And maybe they're not a good fit McGregor, but they're a better fit at Judson or Jennings, and they have an opening. They will get a connection to say, you are a good, you are a match for these other positions. Do you, please click here to apply. And so that it can help, for all of us working together, could help get a better fit for that individual. And it's things, it sounds a little opaque, which I will say from many, in talking to many partners, they're like, well, artificial intelligence, I don't know, maybe that's not the right thing. But it's things like, how many phone calls do you make after hours? So if somebody doesn't like being on the phone and part of their job is, customer service, maybe that's not the right fit for them. Mm-hmm. Or, it's more preference. So there's not a right or wrong answer. And the way that they utilize this data is then they take our historical terminations and hires and how they have, how long they've stayed with the organization, and the model learns and creates changes, let's say a better fit. So there's a neutral, a positive fit or an unlikely fit. Mm-hmm. And Arena currently gives a guarantee that if you don't see a decrease in turnover by 10%, that they will give you your money back. So we're really excited about that piece. But the long-term strategy for us is there is another partnership that is being worked on with the local hospital systems to implement a very similar. So they're creating the hospital corridor. And there's a manufacturing group that's working on a manufacturing corridor, and they'll all kind of meet in this lobby. Mm-hmm. So ultimately, if we're successful, someone that is applying, let's say at a hospital, who never thought about senior living before, but let's say because of their answers are a better fit, they could get served up. You may want to consider this nursing position that's at the location right around the corner from you, and that's a good fit. So for us, when I'm thinking about how do we expand the senior living workforce, some of our biggest challenges are just awareness. Mm-hmm. And so how do we make sure that we are on the list of providers where people want to work and help shift that mindset? So that's one of the innovations we're working on. Really excited for that, to see where this goes.
Yeah, I'm going to come back to the new pilot and Arena Analytics in just a second, but going back to the original partnership, you mentioned training CNAs or state certified nursing assistants in your case. Is it a shared training program then? Is it done in one site or does it rotate? I mean, so how does that work?
So we started as we had it in one location. And that worked probably for the first year. The second year, we have multiple locations. So depending on what is best for the individual, so that they can pick the program that makes the most sense for them. So now that we've expanded it to be more, we used to have one class a month. Now we have a couple of class options and a couple of class locations, which has, again, helped try to remove some of the barriers that get in the way. But we do work with the same schools. So they're familiar with the program. They understand where to send the invoices and all of the things that kind of sometimes will get in the way of starting an innovation like this or starting a program. So we've been able to kind of remove some of those barriers and really share best practices across the group, which has been one of the reasons why we continue to try to find ways to solve these issues together, because we're all having the same, challenges.
And have you done it for any other positions, or are you planning to do it for other positions besides nursing assistants?
So we have not done the earn and learn model for other positions across the continuum. McGregor, because of some of our uniqueness with the PACE program, we've done the earn and learn model with transportation because there's certain certifications in that location and that type of a position. And then we're just starting a model with licensed LPNs. So,
Okay.
but that's more internal promotion to provide some payment for while they're in class. So it's not a one-to-one like we're doing with CNAs, but it's 11 months for become an LPN. So again, it's a step, it's a pilot. We're going to continue to see how this works, but we have to be innovative. We have to, try different things because we know what the demographic issues are challenging our work.
If there's an HR person listening, I'm going to ask the question that they might be thinking of, which is, what are there any legalities around for nonprofit providers saying we're going to hire at this rate, we're going to bump it this time, we're going to bump it this time, and all kind of moving in unison?
So we don't technically use the same. So everyone sets their own, and they're not all exactly the same from that point, but the concept is the same, right? So maybe McGregor starts at one rate and someone, another provider starts at a different rate. But we wanted to make sure that there were designated times for those kind of steps, because the long-term goal was to try to have to align with some of the funding from the government around continuous education or certification programs that have really become the apprenticeship programs, some of those things. There's some additional funding that could allow us to make this program much more sustainable instead of having to rely on internal funds. So that was some of the reasons why we tried to align those stages, not so much what the payment was.
Okay, thank you for clarifying that. And then on the pilot with the AI overlay and arena analytics, is that only for nursing assistants as well, or is that for a broader range of positions?
Yeah, that's for our entire workforce. I mean, so it doesn't, it's the STNA nurses, dietary aides. So one of our biggest opportunities for improvement is with the dining services area. And you can imagine with the competition in some of the let's say the fast food or significant increases we've seen in salary in other places, finding that right fit for dining services is important. And so that's one of our areas that we're working on. So yeah, it does expand larger than just the one position.
Perfect. Oh, we're going to be excited to hear, what that long term looks like. I think you're really forging some new ground here. And I love the concept of the different hallways and the fact that it's true, right? Folks don't realize that even if, say, they're in dining and they're working for fast food, that senior living could be another option, or hospitals or things like that. So I know the partnership, this is all relatively new. Do you have any statistics to share on, impact? Are you seeing any decrease in turnover at this point from the various things, or an increase in hiring on the nursing assistant side?
So I will say that just from a shout out that last year in 2023, we trained more than 88 individuals to become licensed as certified nursing assistants, which for us from a funding perspective, to be able to support it from a philanthropic perspective, as well as helping to expand the senior living workforce, for us, that was a significant number in our small, area. From the retention side, I will say that it's about the same as what we're experiencing for individuals we're hiring from the outside. So part of the strategy around the arena overlay was to try to reduce that turnover and increase the retention of those individuals that are going through the training program, because we can do everything in a positive way, from the training to the onboarding to getting folks started in the role. But if it wasn't the right role for them, because let's say they have a location that's right down the street that's more convenient. It would be helpful to know that earlier rather than later. So yeah, we're having to reevaluate all the time and look for opportunities for improvement.
Yeah. Any lessons that you would share with senior living providers when they're considering whether a partnership makes sense when it comes to earn and learn programs or trying to, share recruiting strategies?
So I would encourage individuals or organizations not to try to do it all on their own, right? Everyone is having a very similar problem. And if we can learn from one, I'm happy to share kind of what we're doing. And if it works in your particular market, great. I'd love to see the success of another not-for-profit provider. And I think that sometimes we look at it as a competitive nature, but at the end of the day, if it's a good fit for a applicant, if it's a better fit at Judson or Jennings, eventually they're going to make that decision on their own. I'd much rather have them end up in the right place at the beginning versus trying to, again, take all of that, I'm going to just keep all of those individuals or those applicants for McGregor. And that's not going to help raise the entire community. So this is both from how do we help support the entire not-for-profit community as well as our local talent, help them have a positive experience.
Yeah. I just love the messages that you've shared today. A lot around, let's not reinvent the wheel or do this ourselves. Let's use our partnerships to kind of raise the tide so that we all are stronger organizations, especially as not-for-profits and as senior living providers. Our jobs are hard enough as it is, right?
Absolutely.
Yeah.
We have enough other struggles that we can spend our time on.
For sure. So Ann, tell our listeners how they can get in touch with you if they want to learn more. And thank you again for offering to be willing to share all this expertise, both on the podcast, and it sounds like you're open to contacts afterwards as well.
Yeah, absolutely. So you can find me on LinkedIn. That's probably the easiest. Just message me that way. But you can also, there'll be in the show notes, there'll be information with my email, which is ann.conn@mcgregoramasa.org. Or you can give me a phone call as well, which is in my on the website. So feel free. I'm happy to jump on a quick virtual call and answer any questions you might have or share some of the documents that we've utilized to kind of go through this. But I'm open to any dialogue.
Thank you. Thank you so much for your generosity on all fronts. This has been a very insightful conversation. I've learned a lot. I'm sure our listeners have. And I just want to thank you for your time today and for being so open with us. I'm Jennifer Drago. You've been listening to Senior Living Visionaries podcast, where we explore the cutting edge ideas and breakthroughs that are shaping the future of the senior living industry. Please subscribe to be notified each time an episode drops at seniorlivingvisionaries.com. Thank you for listening, and we'll see you next time.
You've been listening to the Senior Living Visionaries podcast and radio show, where we showcase the leaders and innovators in the industry who are pushing the boundaries and setting the stage for the future in senior living and services. Join us next time as we share the bold ideas and breakthroughs of the industry's most forward-thinking leaders here on Senior Living Visionaries.